This is Channel 5 News. I'm Hannah Kane.
And I'm Alan Hafer.
We are kicking off our Communicable Disease series with Varicella. This is also known as chickenpox.
We're going to start with a short presentation, then we'll give a special report interview with the nurses, and that'll help you better explain the disease for your knowledge.
What is varicella? It is commonly known as chickenpox and caused by the varicella zoster virus. This virus is also a part of the herpes virus family.
The pathophys, or how the disease progresses, is varicella is transmitted through secretions. It then will enter the body through the respiratory tract. It is believed that the virus is replicated in the nasopharynx and the regional lymph nodes. The incubation period for this is about 14 to 16 days after the first exposure. Adults will first have a mild prodrome for 1 to 2 days before the rash onset, whereas children will first have the rash before any other thing.
The background. So this disease was discovered in 1875 by Steiner, and this also can reactivate the herpes zoster virus, or also known as shingles, and this also can cause shingles later in life. The connection between varicella and shingles was discovered in 1888 by von Bocquet.
Some clinical manifestations or signs and symptoms that you'll see with this disease. With the skin, you'll see blistering, scabs, ulcers, red spots, and these can form pretty much anywhere on the body. With dealing with the whole body, kind of like general like that, you'd have fatigue, fever, lost appetite, and some more common side effects would be headache, itching, sore throat, or swollen lymph nodes. And the older you get in age, the worse the symptoms will be.
Up on the screen behind me is pictures of what the rash of varicella would look like. Commonly, they're really itchy and they may be pus-filled, so that is something to look out for as well.
And with the picture, you can also see the kid is itching his back.
Okay, and now it's time for our special report with our reporter Taylor, and she is interviewing 2 nurses at Ball Memorial Hospital, and this is to help you all better understand varicella.
Hi, my name's Taylor and I'm here with your special report. I'm here with 2 Ball Memorial nurses and here with our interview. So, can you tell us about the prevalence of varicella?
In the past, even up to the early 1990s, there were about 4 million cases each year. Because of the varicella vaccine, the rates have declined 97% from 1995 to 2010, according to the CDC.
That's interesting. Can you tell me more about the varicella vaccine?
The varicella vaccine is a live attenuated virus that was isolated in 1970 by Takahashi. The vaccine was not brought to the United States until 1995 and has dramatically reduced the number of cases per year, as Miranda said earlier. It is recommended for children ages 12 months to 15 months. Usually 1 dose of a subcutaneous injection is effective against varicella, but many children receive a booster. That is 4 to 6 years after the initial dose. Data has shown that the vaccine is 94.4% effective with 1 dose and 98.6% effective when patients receive 2 doses, according to the CDC.
There is also another licensed vaccine established in the United States in 2005. It combines the varicella vaccine with the vaccine for measles, mumps, and rubella, and it is called the MMR vaccine. This vaccine is also recommended for children ages 12 months or older.
So, what do you do exactly if you get the varicella?
The treatment for varicella is mostly to manage the symptoms. So an example of this would be taking Benadryl rub and rubbing it on the rash to reduce the itching, or taking an oatmeal bath to help heal the skin better.
Okay. What are some ways to prevent varicella?
The number 1 way to prevent varicella is to get the varicella vaccine. Another way is to wash your hands and have good hand hygiene. And also, if you know someone who has the chickenpox, you want to stay away from them.
And this has been our special report with Courtney and Miranda. Thanks for watching.
Thanks, Taylor. That was great information. If any of you have questions or concerns, please feel free to call our hotline. It is staffed with educated healthcare workers willing to answer any and all of your questions.
And thank you guys for tuning into our report this morning. Keep tuning in because tomorrow we'll be talking about another communicable disease, and tomorrow's schedule is polio.